what are the side effects of bariatric surgery? So, any procedure that has an effect has side effects. So, for example, of course, obesity is a $600 billion industry worldwide with a lot of gimmick medicines, a lot of sort of capsules from the rainforest and magic pills which are offered in the market, which have claimed to have no side effects, but they have no effect as well. So when you do a powerful surgery which is going to alter your body's metabolism and make you lose weight, it is going to bound to have some side effects. We should see the important thing is not having side effects, but how difficult are these side effects. So something like surgery like sleeve gastrectomy, the basic bariatric surgery we do, the side effects it has are usually only in the first 1 month. First 1 month, the kind of side effects you have is basically a bit of, sometimes when you eat food, you have choking sensation, you have a bit of nausea, you have vomiting. These kind of symptoms may be common in about 30% of the patients in the first 1 month. But after the first 1 month, usually these symptoms are resolved and most of these patients have no side effects. One more problem with sleeve is if patients having reflux symptoms, acid reflux symptoms before the surgery, these symptoms can be worsened after the sleeve gastrectomy. So it's very important for the treating doctor, gastroenterologist who's doing the bariatric surgery. He should actually assess for reflux, and if you have reflux, you should tailor the bariatric surgery accordingly. We either do a Roux-en-Y gastric bypass or a mini gastric bypass and repair the hiatus hernia. If not, that symptom of GERD, gastroesophageal reflux disease, can get worsened after sleeve gastrectomy. When you look at the more powerful surgeries such as gastric bypass and Roux-en-Y gastric bypass, in these surgeries also, in the first couple of months, you may have similar problems like sometimes choking on food, a sensation of heaviness in the chest, because the stomach is now made into a very small pouch. You can have feeling of nausea, sometimes retching, and sometimes choking of food. But these symptoms almost always subside within the first 1 month. So these surgeries being more powerful surgeries because there is some component of intestine being bypassed, there's some degree of malabsorption, you need to make sure that you have adequate supply of nutrients, supplementation of nutrition such as iron, calcium, vitamin B12, and also protein nutrition, so protein energy. So if proteins are not taken, you can lose weight after surgery, but along with your fat, you lose the muscle mass also. So you become thin, but you're not healthy, you're skinny fat. So because of that, after these surgeries, we need to maintain the iron, calcium, vitamin B12 supplements. Also make sure that the patient has adequate protein intake so as to avoid protein allergy malnutrition. So the side effects of bariatric surgery, to summarize, are very minimal, especially after sleeve. Some lifestyle adjustments are required, like for example, you go to a party or a meeting or sit down with lunch with your friends. Each one of them is having like 4 idlis, but after only a single idli you may get full. So it's slightly socially embarrassing, but those are minor adjustments you have to make to achieve adequate weight loss and have benefits which last for the rest of your life, like reversal of all the obesity related problems. So with these, other than these kind of minor problems, with sleeve and minor nausea, vomiting in the first month, no other side effects. With the mini gastric bypass, these are more powerful surgeries, so you need to be followed up with a good nutritionist and a good gastroenterologist who's going to monitor your post-operative outcomes, monitor you for protein energy malnutrition, monitor you for vitamin and mineral deficiencies. But with adequate supplementation of nutrients and adequate protein supplementation, all these side effects can be easily avoided. Another side effect you may see after mini gastric bypass is increased stool frequency because of the bypassed intestine. You might pass 2 to 3 stools a day rather than 1 stool per day. But all these things get corrected between first 5-6 months.